Ladies and gentlemen, CT5 once again. Uh, and I thought this time I would have a lot of fun. Sending certain phrases and one-liners from the TV show Mythbusters. So let's get you guys thinking a little bit. Uh, One of the many one-liners that I appreciate from these gentlemen is, "I reject your reality and substitute my own." Now, that's interesting for us as a community of folks with disabilities. As mentioned in a previous episode, what's normal for us is abnormal for others. Now, what is your particular reality concerning the disability itself? Is it a disability where it can be improved? Is it a disability where it's, dare I say, stagnant? And in my case, particularly with the cerebral palsy, because it's a muscular atrophy, other than because of playing guitar for years with my right hand and my wrist, I have a lot of strength in there. But from my wrist all the way up my forearm, all the way up my arm, to my shoulder, all the way down my right side to my right leg and my right foot. I have movement within those two. I have movement within my elbow joint, my shoulder joint, my hip joint, and my knee joint. However, with my right ankle, I have very little movement because of the muscular atrophy. It's almost the Achilles tendon is tighter than a guitar string, and so there can be no improvement there. Of course, my diagnosis with cerebral palsy is one of many, probably hundreds. I wouldn't be certain of that, and don't quote me on it. After all, I'm just a person with cerebral palsy. I'm not a physician. But once again, my question is, okay, what is your reality, and how do you compromise between the two realities, or the ways of life of somebody who is trying to understand disabilities or your particular disability, and how to help and how to you know understand, not just intellectually but practically, what it is to deal with it. And I think that particular phrase is almost like you're somebody who chooses to be mean to you, I guess. And you can use that phrase as a response to them and say, look, you know, you know, you to to the person who's being crude or particularly mean to you, you can kind of use that as a response and say, okay, I reject your reality and substitute my own. And it's kind of a polite way of saying, okay, you really need to shove off and get out of my way. I haven't used that myself towards anybody, but I wouldn't hesitate to, because once again, it's a polite way and kind of a sarcastic sort of response without being profane. If you can have a sense of humor about this, if you can have a sense of dignity about your disability and the way you deal with it, that's a better alternative than having a sense of, I would maybe describe it as depression per se. Once again, I mean, I use these terms seriously but very loosely, because again, the person does have disabilities, but it is also about accepting the disability, which is a lot harder when you're young because you lack the understanding of it. And so your reality when you're young is a little bit harder to understand and to accept than as you get older and as you gaining understanding about your particular disability, not only from your physicians, but from your caregivers, whether they be your parents, relatives, cousins, and so on. And, when to tell you the truth, um, in many instances, I think families are better suited to understanding the disability rather than the physicians themselves. Number one, because the physician only diagnoses the disabilities rather than, helps the person with the disability on a daily basis. So that sort of reality is entirely different from a practical perspective than from a medical perspective. Again, I mean, comments are more than welcome on this matter. Um, because I deal with several disabilities of my own, a couple that are physical, and a few that are neurological. Physical as well as neurological, in my case, cannot be overcome as far as going quote unquote into remission. Like blindness is permanent. And as mentioned in previous episodes, I have a hard time reading street signs, I have a hard time reading price tags, and so on. And you have to have help from somebody. And when you're younger, it can be a little bit humiliating, but as you age, and in my case, I've had these disabilities all my life, so that's my particular reality. Um, and when I became legally blind a second time in 2021, my thinking was, okay, are we dealing with this again? Really? So for me, it was a little bit easier to accept then, and it would have been easier even in my teens. But again, I'd like to know your input on this matter. Any sort of opinions, any sort of differences in points of view. Um, and so, again, I do sincerely appreciate your time and effort in viewing this. If you would, hit the like and subscribe button to gain more content of this nature. It would be greatly appreciated. And as always, this is CT5 signing off. Until next time, thank you.